As you know, every time you submit a claim, the algorithms for CMS and all other payers are looking to see how you responded to the new medical necessities found within the results of your last encounter. Most people have no idea that exists. We do because since 2007, we've worked in direct collaboration with CMS and other payers to build the value-based grading and management system. In other words, the stick that they used to beat you and not tell you, we turned it around to show you the cheat sheet of how you're being graded and then do the work for you. So here's why it's important. This CMS report card you're seeing right here, we have access to 1,061,000 providers. There are 30 categories you're seeing right here, but these on top ones are the main one. Your missed opportunities, that's missed quality measure opportunities on this doctor is $333,901. The CMS standard of care says wherever medical necessity is found, you must act or face penalty. So not only are you missing this revenue, you're being penalized for not taking it. The next thing I always hear is, well, I'm not seeing any penalties. I know you're not. Just like you're not seeing this grading system, you're not seeing how you're being penalized. This RAF score over here, risk assessment factor, is a combination of two things. What's the risk profile? What percentage of your patients are low, medium, and high risk? We do an entire patient engagement to get that risk stratification and also give you attribution for your ACO. So you get credited. So if I'm getting $48 per patient per month, I want to get it on all my patients, not just the ones that they happen to recognize. This billable encounter makes that happen. But once we start that, then we say, okay, now we know what we're missing, what patients are missing those. And then now we say, okay, what services do they need? We need to connect them. So these things we're talking about happen in the background. That's why we call it the precision stealth workflow intelligence. You never see it. No new technology to learn, no staff, no cost to you. We're doing this for you and connecting those dots. Now, on average, most providers are missing between $200,000 and $350,000. Here's $333,901 Now that's just on Medicare. So now we say, okay, well, how does that extrapolate across the entire patient population? Well, we've built a spreadsheet here called the ROI calculator. And what we do is we take the number of patients in a practice and we put it in here and it automatically calculates the bare minimums based on medical necessity. Okay, so come back to that in just a second. But here, on 2,500 patients, you're probably missing on average $294,000, $30,000 net profit to you simply by not letting us run this in the background and you never see it or pay for it. So take that in mind. Now let's come back up here to this RAF score piece. The important part about this is that, again, the CMS standard of care requires that you act where medical necessity is found. Guess what? That's all our system does. It finds, qualifies, validates, documents medical necessity. Why is that? Look at this company here. They're called Ivicor, not medically necessary. Inside the company helping America's biggest health issue insurers deny coverage for care. They are paying millions of dollars. The payers are paying millions of dollars to this company to pre-deny your claims because they know you do not have documented and validated medical necessity. We fix that, and we fix it overnight, and you never see it. So we come back over here, and here's the CMS pay report. There's a little video at the top. You'll see here's this what we're talking about right now. It's urgent that you understand this process and what happens. Look, I'm not asking you to do anything but empower us to help you. And by empowering us to help you, that means that we have to you have to be supporting us. You have to know what we're doing so we can help you. You won't do that if you don't understand it. So please take 10 minutes and understand this. Read the demo link, and let's go from there. Thank you very much.